Hello, I'm Dr. Lauren Young, and this is Dr. Julia Vitali, and welcome to our peptide nutrition program. Excited for you to be doing this with us. This is our little orientation to give you some little tips and tricks and kind of let you know how it's going to go. Just a couple housekeeping. We will have meetings twice a month, one Thursday morning and one on a Wednesday evening and every other week. And all the signups for those are on the website under events. So feel free to pop into those. They're certainly not mandatory, but they're a great way to stay inspired, ask questions, hear other people's experiences, get tips and tricks, those types of things. So we're going to be available for those every other week. Also, you'll notice on the website, there's a lot of resources there. Please feel free to use them. And if you have any one-on-one questions you'd like to ask, there is a great place to ask that as well. There's a little button that you can click, fill out a form, let us know how we can get a hold of you and help you along the way. We are definitely committed to seeing you succeed with this. So, one of the things we want to talk about when we talk about success with this program is eventually not being on the medication. This medication is a wonderful tool. We've been doing this program for well over a year, and honestly, even before that, working with people using the semaglutide and tirzepatide to help them with their journey. So we have goals that we want to make with our lifestyle, and at the same time, we're running kids around and living busy lives and having stressful work deadlines. And so this is a wonderful tool that helps with our willpower and helps make the lifestyle changes a little easier. So when we're looking at our lifestyle, we want to think about all the different aspects of our lifestyle, not just eating less. We want to look at stress reduction, which means our environment, both being in nature and keeping our home space and our workspace in a safe place, a calming place, making sure we're hydrating, moving, sleeping well, finding joy and connection and community, not really relying on stimulants or depressants to kind of manage ourselves and regulate ourselves. So if you look at this little wheel right here, you want to just rate yourself for each one of these little pie slices. One or a lower number being, you know what, I'm not great at moving my body. 10 being training for an Ironman, and the rest of us somewhere in between. So you want to assess yourself for every aspect of this. And I will emphasize that some of these pie slices are more important for success with this program and this medication than others. However, you may notice that oh geez, I get home and I am just so stressed out by clutter or something like that, or what, I'm leaning a little too much on coffee. Making sure you're addressing those aspects of things too, because again, we want this to be sustainable, and that means looking at the whole picture. And what's going to really help make weight loss sustainable is balance in your life and stress reduction and addressing the root cause of imbalances in our nutrition. When we're making goals, and I highly recommend making a goal even before you start on the medication, we want to think about making them SMART goals. There's a lot of research showing that the best way to make something stick is to make it specific, measurable, attainable, relevant, time-based. I'm going to go for a walk after dinner 3 days a week would be a great example of this, because it's something you can really succeed in and measure and see that you're getting it there. If you want help with these goals, happy to help you. There's also some resources on our website around goal setting and making change lifestyle wise. So nutrition, how am I supposed to eat when I'm on this program? What am I supposed to be doing and eating? There is no meal plan. And the reason for that, again, is that we want you to be able to go to your grandmother's birthday party and have a slice of cake if you want. The medication is going to have you not eating as much. Medication is going to make it easier to make good choices. And so we're not going to restrict any specific foods, but what we will say is there are some tips and tricks to maximizing the effectiveness of this medication and minimizing side effects. So hydration is key. And this is something you should start on before you even start the medication. So what I would say is aim for at least 60 to 80 ounces of water a day. The old adage of half your body weight in ounces isn't bad either. Get a cute water bottle, go around with it every day. Make sure you're getting enough water in on a regular basis. This is really going to help mitigate side effects. And it's also going to help your body detox and process as you're losing weight. The other thing I would really focus on when you're looking at nutrition is protein. Protein does a lot of things. It's going to help stabilize your blood sugar. It's going to help maintain your muscle mass so you're not losing muscle while you're losing weight. And so, and it's something that, like, you should be making sure you're looking at your plate or every meal and making sure you're getting some of that in, especially as we start on the medication and every time you go up in a dosage, you're going to find a dip in appetite, especially. You want to really make sure you're focusing on getting adequate protein. If you want specific amounts and measurements, we can talk about that one-on-one because everyone's a little different, but think about focusing on a good bolus of protein, 20 milligrams at least, or 20 grams or 30 grams at least at meals. Next, again, this medication turns down the food noise. And so it gives you this window where you can now look at your habits, look at your cravings, look at your patterns. And what I would invite you to do is be curious about it. How are you coping? Why are you hungry? What do you usually do at this time of day? A lot of us find ourselves snacking in front of a TV. Are you passively eating? Are you eating for energy, for comfort, for habit, because you think you're supposed to? Just kind of be mindful and be aware of it. Looking at these patterns can help us create new patterns. And that's really what's going to help be sustainable beyond this medication as well. Again, with the food noise turned down, you can kind of look at your old habits and then build new ones. And again, this new habit building is going to be something that's going to be long lasting, which we're excited about. Lastly, intermittent fasting is another way to really maximize benefit. There's a lot of great research on intermittent fasting, from insulin resistance to helping prevent certain cancers, cognitive decline, and help with gut rest. And so basically, closing the window of time that you're eating meals. So if you are, not hungry for breakfast, you can skip breakfast, and that's actually a lot healthier than we realized back 20 years ago. And so what I would suggest is you still hydrate, and you can still have a cup of coffee if you want, if it's not got a lot of cream or sugar in it, kind of thing. You can make what's called a bulletproof coffee. There's lots of tips and tricks to do more with intermittent fasting, and I can give you some more resources around that if you'd like. There are some on our website under talks. But intermittent fasting would allow you to have good gut rest, which can again mitigate the side effects a bit, which we're going to talk about in a second. And it's also going to help with insulin resistance, weight loss, and stimulating a process called autophagy in our bodies, which really helps cellular cleanup, so to speak. This will help promote detox as well, which will help us from plateauing. So while I'm not going to give you a meal plan, there are a lot of recipes on the website for you guys to check out and try. Really focusing on whole foods is going to be my goal, but really in the back of your mind, be curious about your patterns, drink your lots of water, where's your protein on your plate, and feel free to close that window of time so that you're eating maybe less meals or a smaller window of time and getting some benefit from burning down your glycogen stores and fasting. Dr. Vitali, do you want to talk about the two medications?
Yeah, so the peptides that we use in this program are semaglutide and tirzepatide. When we started the program, we only had access to the semaglutide, which is Ozempic or Wegovy. And since then, tirzepatide has also become available, which is also known as Mounjaro, or Zepbound is the new medication that is out. So these medications are peptides, which are essentially proteins. They work on a couple different things in your body to help you lose weight. And by understanding that, you're better able to understand the changes that you're making and why the weight loss will be sustainable, and also understand why you might be having side effects to hopefully mitigate those side effects or not even have them at all, because you can make some of the changes like increasing your protein and increasing your water before you even do your first injection. So one of the things that it does is it works to make food sit in your stomach longer. By sitting in your stomach longer, it's going to affect your metabolism, which will then kind of have this cascade effect of helping you lose weight. And it will also lead to some of the side effects that we talk about. It also works on your brain to increase satiety or turn down the food noise. So one of the benefits of this medication for people is definitely that they notice their cravings go down. Oftentimes when we're dosing the medications, people will say, how do I know when I'm at the right dose for me? Because it's not the right dose. Not everyone's dose that they want to stay at will be the same dose. And it's that balance of when you feel like the food noise is turned down, not having side effects, being able to tolerate it, and also noticing weight loss. We really want this weight loss to be sustainable. So our goal for you is 1 to 2 pounds a week. Some weeks might be a little more, some a little less, but we're looking for that overall kind of slow decline because that's where it shows that people are able to maintain that weight loss. The other thing that we want is we want to make sure you're losing fat and not muscle. When you come in for the yeah, I want to make sure I didn't say that backwards. You're losing fat and not muscle. And when you come in for the BIAs with Dr. Holland, which you may have already had your first one with the BIAs, that's one of the things we're looking for. So the feedback you'll be getting is that's great. We're seeing fat loss, not muscle, and that you're hydrated because hydration is so important for weight loss. You can go to the next slide. So I mentioned how we do personalized dosing. When you get your medication, whichever one it is, it's going to come with a chart. And the chart is going to have a dose increase every 2 weeks. If you feel like that is too fast and you don't want to go that fast, you are welcome to go slower. Or if we're not noticing the effects that we want, we may have you go faster. Anytime you have question about dosing, please reach out and I will call you back and we'll talk it through. The benefit of doing this through a compounded pharmacy is that you're going to get a vial of medication that comes with syringes and we can draw up. It's not a pre-made thing that says this is the dose you have to do. We can make it work for you. And I think that's part of the reason we see a lot of benefit with it is that people are able to go up at intermittent jumps instead of doing the large every month jump that's typically people have done in the past without compounding. And so by doing those intermittent jumps, it's not as much a shock to your system, so you don't get as much as the side effects. So the thing to remember is, yes, there's that chart, that is our guideline, but if you need something different, we will figure that out. Side effects, that's the thing that people get most worried about. I'll say, and I think Dr. Young can agree, that these medications, although yes, they do have side effects, are pretty well tolerated in general. Most of the people say if they had something, it lasts a day or a couple of days and then it's gone. But we have tricks and we also can have medication if necessary or supplements to help kind of counter any of the side effects. The most common by far and away that we see of side effects are on your gastrointestinal system, and that's because that is the major place that the medication works. Because food sits in your stomach longer, that can play a role in causing nausea. Vomiting, I would say, is rare, but if people are nauseous, typically what we'll recommend is maybe the day that you take the dose, the day after, kind of increasing ginger, through supplements or tea. If it's very bad, yes, we have medications for that, although I will say that's has been super rare. Um, Nausea can also be prevented by making sure you're drinking enough water and making sure that you have enough protein. The way the medication's working on your pancreas to release insulin, if someone's having very carb heavy meals and not having enough protein, they notice more nausea as well. So that's something we would definitely want to look at. Not as common, but also possible is diarrhea or constipation. If these happen, the GI side effects, they normally happen 12 to 24 hours after the first dose and can resolve um, within a couple hours, a day. If it lasts longer than that, you can always call us and let us know, or at any time we'll talk it out. But the most common times people find this is when they do their first dose. It can be with any dose increase. So just something to be aware of if, you're going to a wedding on Saturday and you want to make sure you're in tip-top shape, maybe don't do your first injection on a Friday just to make sure that you're feeling okay. The next GI side effect that people will say, and I maybe should have put this first because this is probably the most common one, is heartburn. It's also an easy one to adjust because I would say heartburn tends to happen if people are eating too close to bedtime. This is where intermittent fasting is a very helpful tool for this. Because food is sitting in your stomach longer, if you're normally used to eating 8 o'clock and going bed at 10, now the food that's already been digested by your normal bedtime is not. That's sitting in your stomach. Your body has produced acid to break that down, do its digestive processes, and when you lay down and your little sphincter opens, that acid is going to go up, cause heartburn in your esophagus. So just be aware, am I having heartburn at night? Do I wake up feeling it in the morning or feeling reflux? Let me move and not eat so close to bedtime. The other thing is that you may be eating smaller meals, and your body at the beginning may be used to producing a certain amount of acid to break down these meals. So some people do require either a natural, something natural to help them, or over-the-counter medication like Pepsid. Just when they start the medication, if they're having reflux or when they increase their dose, because that acid is bothersome, usually it regulates itself, but just something to be aware of. And if you have a history of that, uh, you'll know that it happens and we can talk out solutions. These are very, very rare. I've actually never seen them, but I want in from these medications. I've seen them, but not from these medications. But I want you to be aware that the rare things that can happen, because it is causing your body to work on its GI system, is pancreatitis and gallbladder disorder. How these would present in you is severe abdominal pain and vomiting. Um, if you're having severe abdominal pain that is inconsistent with what you would expect, something we definitely want to look for, so please let us know. The next side,
Additionally, I would say really any GI symptoms that you're having, this is a great time to reach out to us because it really should be manageable. And we don't want people telling us like a week later that they haven't had a bowel movement in a week. So we need to know these things right away so we can get on top of any side effects that people do have. And, this is a time again to listen to your body and make sure we're addressing it if it comes up. Sorry to interrupt.
no, good. The next most common side effect that I don't even want to say common, not common, that is possible is headaches. When we first started this program, we actually didn't give people all this information that far, like a week in front of them getting their medication. And we found that when we gave them time to increase their protein and increase their water, the amount of headaches I heard people tell me they have drastically went down. So
Yep.
the headaches, if they're a side effect, and number 3 as well, fatigue, are most likely from dehydration and not having enough protein, having your diet be more carb heavy rather than protein heavy.
On the flip side, I'll say many people report feeling great on this medication, energy wise, mood wise, things like that in a good way. So that is we don't want to scare everyone, but if
Yeah.
we notice these things, ping us because this is stuff that we should address.
Yeah. Changes in mood came out because it came out as a study after the medications had been out. It is very rare, but it's something that if you stop the medication, mood reverts back to normal. So I just want you to be aware, if you're feeling low, you're feeling like your thoughts don't feel normal, please let us know and we'll talk it through. But as Dr. Young said, most commonly people will say after the first couple weeks, they're like, well, I haven't lost 10 pounds, which I don't want you to lose 10 pounds in a couple weeks, but I do notice my energy is better. I'm sleeping better. I feel like I can handle my stress better. And it's because of all the other ways that the medication works, that what comes along with that after is the weight loss. So when we talk about goals, we don't want your goal just to be, I want to reach this number. We want your goals to be how you want to feel, what you want to be doing, and things like that, because that will be things that hopefully will come, from being part of this program. The other question we get asked a lot is, are there medication interactions? Is there anything I have to worry about? We've looked through your entire chart, so we know that you don't have any contraindications to being on the medicine, but just something to be aware of is if someone is on oral contraceptives, that is the only medication that's contraindicated with this, because it doesn't work, because it won't be absorbed the same way. All other medications are not an issue. So the other thing, other than side effects that people worry about, is how to give themselves an injection. I will say almost very few people come into this program knowing how to give an injection, and everyone that's gone through has been able to do it. Many think that they won't be able to, but we've got you. We're here to help you. If I will show you how to do an injection now, how to drop the medication and do an injection, but I'm also available to do either one-on-one, in person, or online teaching with you. When you're called to say that your medication is here, please let Shannon know, she's our point person, that you wanted me to teach you how to do it, and that can either be in person or we can do it through telehealth on Doxy at any time, or I could FaceTime you, whichever's easiest to talk you through the process. So to show you, I just want to talk you through it. What you'll get when you get your prescription.
I'm going to interrupt you. I'm going to make the screen bigger, so we're going to take off this. So just do you want to like emphasize that these are the areas that you're going to do the shot, and then I'll take it off the PowerPoint and focus on you.
Yes. Yeah. So I'm gonna, because I'm not injecting myself, you're not gonna see me inject it into this. I'm gonna inject to show you an injection into a sweatshirt. But when you do it on yourself, this can be done technically in the back of the arm, but that's very difficult. So I recommend either doing it in the fatty tissue of your thigh or the fatty tissue of your abdomen. It's meant to be a subcutaneous injection, which just means that it goes into the fatty tissue that's under your skin. It is a very shallow needle. And so you don't have to worry about going too deep. So I think the easiest thing is pick your belly button, go about 2 inches away on either side, whatever feels comfortable to you. And when you're ready, you're going to kind of wipe a whole area clean, so it doesn't have to be exact where you're giving it, because this is a very forgiving process. So yeah, and you can go to me. Okay, so when you get your vial, you are going to get, it's going to come in a blue bottle like this that looks like a regular prescription bottle, has your name on it, has the prescription. If you do need to travel, bring this with you. Don't bring just the medication inside, because this is what makes it look like a prescription when TSA looks at it. You can travel with it. The only thing to remember is that it should be kept at room temperature for no more than really, we tell you 24 hours, so just keep that number in your mind. If it is out longer than 24 hours, let me know. But if you're going to travel with it with an ice pack, and it should be fine. So when you get this home, I recommend you keep this. You can keep all your supplies, whatever's easiest for you, all your supplies in the fridge, or just the medication. The medication should be kept cool. But like I said, if you leave it out on your counter, if it's more than 24 hours, just let us know. But really, there's a longer leeway than that. I just like to talk it out with people if they left it out on their fridge. So you're gonna get this vial, opens up like a prescription. Inside is a bottle that looks like this. This is dark so that the medication is not exposed to the sun, because it helps keep it active longer, but in your fridge, you don't have to worry about the sun anyways. The very first time, this blue cap is just gonna pop right off. It will not go back on. That's just to let you know this was a vial that was sterile and made just for you. For those who are not familiar with medication vials that look like this, they're made of glass. They come with a metal outside here, and there is rubber on the middle. As you can see, there's like an inner part and an outer part. It doesn't matter. You don't have to be specific. The needle just has to go through that rubber. That's how you're going to get the medication out. You don't have to worry ever after it's been poked about turning it upside down, because the medication will not fall out of here. You're also going to get syringes. I urge you to kind of be more comfortable with this. It comes with a back that covers the plunger, and a needle and a top that covers the needle. So before you even do anything, I'd say take out the back and kind of play with it in your hands, so you see what feels comfortable to holding it. How big is it? How hard do I have to push to get it in? Because however hard you have to push when it's empty is pretty much how hard you're pushing when the medication is there. So I just want you to be comfortable with this before you give yourself the first injection. Every week you are going to use a new needle, but it is the same vial that will last however long 5 units is. For some people, it's 8 weeks. For some people, it's 10. Everyone's a little bit different. So those are your supplies and an alcohol pad. When you're ready to go, you're going to rip open your alcohol pad. You're going to find where you want to give it to yourself on your abdomen, and you're going to wipe yourself clean. You're also going to wipe the bottle to make sure that this is clean as well. So you have enough alcohol pods and syringes that will last you probably more weeks than the vial does. But if at any point you ever need more, please let us know. You're going to take your syringe. You're going to pull off the top, and this is the needle. If I put it close, it might look big, but in reality, it is very small. It's very fine. This is called an insulin syringe. Most often people say, when I say push it into yourself, they're like, oh, and I say, you're all set. They say, oh, I am, because it's so small that it doesn't hurt like when you go to the doctors and get any other type of shot from the doctor. What we're going to do to make the process easier is you pull back on the syringe. Doesn't really matter how far, maybe halfway far. Take your medication. You can do this sitting on the table or whatever feels comfortable for you. If you're more comfortable holding in the air, whatever is comfortable. You take the needle, push it in through the rubber, push the air upside down. Turn the whole bottle upside down, and you can then pull back on the bottom of the syringe. Because we put air in, it's going to push it a little, so you'll feel it. The first time we are going to go back to 12 units. So when you're looking at the needle, it has, let me show you. It is marked 10, 20, 30, 40 with little dashes. The little dashes in between are 2, so 12 is just past the 10. It doesn't have to be exact. If you give yourself 14 instead of 12, it's not the end of the world. We just want you to be, as close as you can. So again, get comfortable with the needle before you're ready. You're going to pull on back to the number, and then you just pull it out. Because you already wiped your abdomen clean, it's all set and ready to go. So I'm just going to grab something to show you my technique. So to show you my technique into my sweatshirt, I like to hold it like a pencil or almost like a dart in my hand. And I would put my other hand like this to give a shot, just to know where my hand is. So if you can see, my hand is like this. So I'm very aware where this is. You just put it next to your skin and then press in. It's not going to go in quite so much because your skin's a little harder than that, but it goes in very easy. And then you press in the back, or you use the same hand, whatever feels comfortable for you. And it should go in very easily, and then you are all set. Was that clear? Is there anything I missed, Dr. Young?
No, that was great. What you do with the needle afterward is a good one to talk about. And
Yes.
yeah, so we'll do that. And then the other thing to remind people is it's a big vial. It's not that much medication in it. I promise you it'll last the 8 weeks at least. Everyone always thinks it's not enough, and it always is. It just doesn't look like a lot in there. You just got to make sure you turn it upside down and get it in the syringe.
Yeah, so the vial, they use the same vials for everything. So turns out that it looks like a lot less than it should be, but it really is. It's gonna look less than half full when it comes, so don't be surprised. And yeah, so it's gonna look less than half full. These are considered sharps, which means that you don't want to just throw it out in your regular garbage. You can put it in any hard plastic container you have at home, peanut butter container, laundry detergent, anything that's hard. Mark it with a permanent marker, write sharps on it, and then you can put it in the container and throw it in the garbage, because they will separate it. The other thing, if you're not comfortable doing that, you can collect them at home and bring them into our office, and we'll dispose of them for you.
Easy peasy. Yeah, so I think those are the main things that we want you to know ahead of time. We usually have people do this first introduction, and then the medication is on its way. You'll get a phone call from Shannon. She'll say your medication's in. You'll get a bag of stuff, like, the dosing form and syringes, alcohol swabs, and medication. And when Shannon calls you to get all this queued up, this is when you can let her know, can I set something up with Dr. Vitali if you want some help? Everyone who would thought they would be scared of the shots really aren't. So it's really not that big of a deal. And a lot of people were scared about side effects, and it's really not that bad, truly. So we're excited to have you guys join us, and please ping us for more resources, and welcome to the program.